Dr. Riou from the Riou Plastic Surgery Center. Thank you for joining us today. Today we have the privilege of having Amber with us. Thank you, Amber, for joining us. Amber is a 32-year-old professional photographer who has had two children, one in 2011, one in 2015. We saw her the first time in 2011 after her first pregnancy. She had a 36B breast, but had gotten as high as 36D to double D during her breastfeeding. She breastfed for 6 months and came in with significant loss of volume. So we did a submuscular augmentation with a Mentor 325cc filled to 350. She did well with that. However, on her second pregnancy in 2015, her breast increased further to double D. She breastfed for 18 months, and once that was completed, her native breast volume decreased significantly. So she came back with a small C and significant stretching of the skin. So her desire at that point was to improve the skin envelope as well as to exchange the previous saline implant to gel. So Amber's second surgery was this past July, and on that second surgery, what we did was we corrected the skin laxity as well as the loss of native breast volume. There are several ways of doing a lift. This particular instance we did a peri-areola lift, which is a donut lift. So the incisions are limited to around the areola. If there's more significant skin, then we need to do a circumvertical, which is a lollipop scar, or the more extensive inverted T, which is an incision underneath the fold as well. So we were fortunate enough to do limited scar lift using the donut lift. And we switched out her saline implant to the newest generation Mentor memory gel implants, and these are called the Extra Moderate Plus Profile 465. So this provided better volume improvement and better feel. So Amber, thank you so much for joining us. Let's talk about your decision to proceed with plastic surgery to correct your breast deformity.
I think my decision was based on pregnancy, and after my first pregnancy I gained a lot of weight. I gained 80 pounds, lost it fairly quickly, but that was one thing. With training, with dieting, I couldn't get that in shape. My chest, I could do as many chest exercises. You just couldn't fix the loose skin, and everything else on my body was back in shape. And that was the thing that I was super self-conscious with. So that was definitely my first, or the reason why I decided to have plastic surgery for the first time.
Right, and that's pretty typical. The majority of our patients are very conservative, post-childbearing women who are very disappointed with the effects of childbearing on their breast. Typically, they're working out regularly, they eat well, they're at a normal weight, and the rest of the body has returned to normalcy, but the breasts are impossible to correct without surgical intervention. In Amber's case, her second pregnancy really made it even worse. The skin stretching was more significant. She'd gone to double D, I think, on your...
I nursed my second child for 18 months, and so same thing, I gained 60 pounds with the second pregnancy. So I lost that, got in shape again. And then I noticed, I had more, my natural tissue had deflated just because I got to a double D nursing him for 18 months or so long. And and also my areolas had stretched significantly from nursing so long. So that was one thing I said. And I made my decision easy for the second surgery.
Right. So that's pretty typical. The areola tends to stretch out and the skin becomes very loose. So even though she had an implant in that we had done a few years earlier, that implant volume didn't change, but her native breast volume decreased even more. So we needed to do an upsize and also switch her to the latest generation Mentor Extra. So Amber, how was your experience after the first augmentation?
After the first surgery, I was really sore, chest muscle wise. It felt like I explained it to some of my girlfriends. It just felt like a really hard chest workout I had done for a couple of days after, so pretty sore.
Yeah, and that's pretty typical. Amber's first augmentation was a submuscular approach, and that's the way we do most of our augments, be it saline or silicone. Um, and it has a disadvantage of being a little bit more sore than doing it in front of the muscle, but there's a huge advantage of having a lower incidence of capsular contracture. And that complication is our biggest nemesis. Fortunately, it's very low in the range of 1 or 2% when we do it behind the muscle versus 8 to 10% in front. So it basically involves having the implant become firm because of the scar around it, and it requires a lot of additional surgery to try to correct it. So trying to avoid it is paramount, and that's why we choose to go behind the muscle, even though it's a little bit more sore to recover. Fortunately, once the first surgery has been done, when we switch around the implants or do lifts afterwards, you don't have to go through that original pain. And that was the case for Amber. Her first surgery was 2011, and then after her second pregnancy and breastfeeding for 18 months, we did upsize and a periareolar lift. So even though that surgery took longer, there was less pain post-op. Would you agree?
Agreed, totally. I had no muscle pain at all whenever I did the second time around, and you had told me that, but I didn't know. I was like, sure.
Yeah, you were probably expecting.
Yeah, I was expecting some, none at all, and I felt like they were already kind of in their pocket. Like I didn't feel like they were high or tight or anything. It was much easier the second time around.
So Amber, talk to us a little bit about the difference in implant type. On the first surgery, we used a saline implant, but we noticed after the second pregnancy that your native breast volume went down significantly.
Right.
So there was less padding in front of the implant, and you were working out a lot. Your total body fat was low. So we decided to go with the newest Mentor implant. It's basically a cohesive gel implant, memory gel. It's called the Extra, and we use the smooth moderate plus profile. So what's your thought about that compared to the saline?
I think the new gel just feel more natural. I had lost so much tissue from my natural breast after the first that I could feel the saline bag, and that was partly because I had lost so much tissue, but this just, you can't tell where the implant is versus where my natural breast tissue still is. So it just feels like a real breast.
Right. And that's a typical description we have. So our default implant for those that have a significant amount of breast tissue and are not underweight is still saline implant because they're easy to replace. But more and more of our patients are very health conscious. They keep their weight low. They work out regularly, so their total body fat tends to be pretty low, and also their breast tissue tends to be low as well. So in those particular situations, even though it's behind the muscle, the part of the implant that's not covered laterally and inferiorly tends to have ripples, either palpable or visible. And that was the case for Amber, especially on her second pregnancy, because her breast stretched out more and there was less normal tissue in front of it. So I think it was a good idea switching over to gel.
Yeah, I was very happy with it.
Excellent. So Amber, talk to us a little bit about your research process and how you picked our facility to have your surgery, and was the internet useful as far as your research?
It was pretty useful for me. I have a lot of family members and girlfriends who have been here and had such a great experience. So talking to them and hearing their experience and seeing their results, but also seeing on the website before and after pictures of just kind of, cases that were a little similar to mine, and seeing what their after results were. That was a really helpful tool for me to decide.
And what was your ultimate goal in having the surgery? I know you worked out a lot. You basically got your body in the best shape possible after having 2 children, but you were still disappointed in the look. So I guess you came to the conclusion that there was nothing non-surgical that you could do.
Right, and I think just being 32 and a mother of two, I still wanted to feel attractive and look attractive, and that was very important to me. And I think just as a mom, just because you're a mother of two doesn't mean that you still can't be the best you can. And that was one thing that I was really happy to decide plastic surgery, because that was one thing I couldn't fix on my own.
Right. And that's the case in most of the patients that we see. For the majority, they are conservative, post-childbearing, attractive, try to do the best they can as far as eating healthy and working out. But like Amber, they're disappointed that all that hard work doesn't lead to the result that they want. So in essence, plastic surgery is not to make the breast bigger, it's to make it normal again as it was pre-childbearing. And that's the case also for the abdomen. A lot of times the abdomen will be stretched out, and we'll do a tummy tuck as part of a mommy makeover in addition to breast augmentation and lift. So our ultimate goal is to make the breast normal again and make the abdomen normal again, not to be obvious. So my ultimate litmus test for a successful augmentation is actually not to make the breast bigger, it's to make it normal and not to be visible in a bathing suit that they've had an implant. And that's our ultimate goal for the most part. Any other caveats for patients that are looking to do this kind of surgery?
I recommend it to a lot of my mommy friends. With clients, with newborn shoots, that's one thing that always gets kind of brought up, just how much your body changes during pregnancy, after pregnancy, and so on. So I'm always the first to suggest and say how happy and easy I was, or how happy I was with the results, and how easy it was in the long run. It was easy.
Excellent. Well, Amber, thank you so much for doing this interview. It's very helpful for patients that are thinking about doing this. I appreciate you.
Thank you so much for having me.
Thank you.